Okay, so welcome in this NEXTEUK Virtual Seminar Series online. The idea today is to discuss the future of EU-UK relations in times of COVID-19. We are all gathered in this project, and we all have different perspectives in the countries where we are actually experiencing personally the lockdowns, but also from our own maybe countries where we are from. So I'm Sarah Wolf, Director of the Center for European Research, and I'm French, but I'm now in the Netherlands, where we are witnessing an intelligent lockdown. So I think what I would like to start with is maybe to give to all of you the opportunity to let us know, to introduce yourself, to let us know where you are, how is the COVID-19 lockdown being experienced by yourself, but also based on the country you know best, what are your views? And basically, I just wanted to make a short introduction also on the EU response to COVID. I think in general, initially, the EU has been highly criticized at the very beginning of the crisis for not responding quickly enough, for lacking the means to coordinate properly the different member states in addressing the COVID-19. And there has been also a resurgence of traditional divisions between the North and the South. I'm in the Netherlands. Prime Minister Mark Rutte has been quite vocal on not necessarily showing solidarity towards Southern European countries that have been mostly affected by this crisis. So we can also reflect a little bit on how and whether is the EU doing? How is it coping with the crisis? Whether it has drawn lessons from previous crises, and I will get back to you on these issues. But maybe first, could we go around and could you introduce yourself? Let us know where you are, what is your view on COVID-19 from the country you know best. Could we maybe start with Stella?
Okay, thank you, Sarah. So this is Stella Ladi from the Center for European Research. Well, I'm in London at the moment, experiencing the crisis here. But I was going to say a few words for Greece, since it seems to be a best practice for once. So, you know, it's very enjoyable not to just talk about all the bad of the economic crisis and the austerity, but what this has meant for the COVID crisis management. And I think there are 3 points. The first is that exactly because of the austerity and of the cuts in the health system, the government was really aware of the weakness of the health system. And I think this is what urged them to have a very early response. So they started taking the measures before even a death was recorded, shutting down schools and really strict measures. So this was the first early response because of the previous austerity in the healthcare. The second was a communication strategy, which has been very successful since it has been very, very much evidence-based. So every day there is a 6 o'clock press conference with the chief doctor, spokesperson of the Ministry of Health, epidemiologist, explaining exactly where we are with deaths or with new patients, and what is the exact situation in the country as far as the virus spread is concerned. And then straight away, the Minister for Civil Protection is starting introducing the measures that are going to be put in place because of what was explained. And then at the end of that, they are trying to deal with any kind of fake news that have appeared in the media in the last 24 hours or in the discussions, whatever they have managed to catch. They're trying to bring it a little bit more down to the people and to everyday kind of practical solutions. So this has worked very well. And the third point was that the people actually obeyed, which is something we didn't expect either. And this was because there were fines implemented very quickly if people did not obey, but also this cultural idea that health is the most important good that we have. And there was no real debate whether the economy should come first or what would this mean for the economy. So in a way, it was accepted that the economy will suffer. It was accepted that we've done that before, we've been through that before, and they prioritized health. So I think this is what made it good up to now. What will happen next? Nobody knows, because everybody wants to open the economy now, slowly, since now we have almost 0 deaths per day, and 6-7 cases per day are recorded for new COVID-19 patients. Tests have not been massive, so obviously there are many more people there that have it. So opening it up will be gradual, but this is the next thing to observe and see how it's going to be. I don't want to take more time, so that's enough for me.
Oh, thank you very much, Stella. And indeed, I think the case of Greece is quite extraordinary given the austerity or the legacy of austerity politics on the health sector as well. And contrast a lot. I think I've noted today 121 deaths only in Greece compared to numbers we have in Italy, 25,000, and Spain around 22,000. So that's quite remarkable. And if I may, I would like to stay a little bit in the same region and maybe move to Davor. Well, I hope you're doing well. And I think you're able to let us know a little bit more about Serbia and Montenegro. And I've noted that Serbia had one of the most drastic lockdowns in Europe.
Yes, thanks, Sarah. So my name is Davor Jančić. I am a senior lecturer in law at the School of Law at Queen Mary University of London. Thanks very much for organizing this. It's lovely to join you all. So yes, we are all well, thankfully. I actually did have one period when my voice was very deep for a week. So I woke up one morning and my voice was just extremely deep. I had no other symptoms. I didn't feel, unwell in any way. But anyway, there was a period in my life that I had a very deep voice. Which everybody liked, by the way. Anyway, so what I wanted is to really summarize a couple of measures that the government has enacted in response to coronavirus crisis. I just first want you to put this in context, so you have an idea of the scale of the response. Yesterday's data say that there have been 7,114 confirmed cases and 134 deaths. So that's a mortality rate of 1.88%. The average age of those dying is over 64 years of age. And I just wanted to also say that estimated life expectancy in Serbia in 2017 was 76 years. So, so the people dying are really, the elderly people. So yes, Sarah, you said that the response was dramatic, and that is true. The executive, meaning primarily the president, and to a smaller extent also the government, because the president is really driving the response, they have enacted a large number of administrative acts to tackle the crisis. So the most important one is the proclamation establishing the state of emergency on the 15th of March, and a series of measures that have restricted the freedom of movement of people. And I just wanted to sketch those because they're quite incisive and they really are quite strict and restrictive of people's rights. So let's start. So first of all is the curfew. The curfew is nationwide and it applies to all residents, and it lasts from Mondays through Thursdays from 6 p.m. to 5 a.m., right? So in the evening, you can't go out. So basically, once you stop working, that's pretty much the time you have to go back home, yeah? And also on Fridays from 6 p.m. until 5 a.m. the following Monday. So that's the entire weekend, yeah? Catches Friday evening all the way till the early morning on Monday. There are obviously some exceptions in terms of residents who have a medical urgency or people who need to work. Now, another thing that actually impacts my parents is that people age 65 and older, they are prohibited from leaving their homes almost altogether, except for Friday mornings, but now listen to this, from 4 a.m. to 7 a.m. to do their groceries. Guess what most pensioners do at 4 a.m. on Friday morning? They sleep like everybody else. So that's not very helpful, yeah? And recently, there was another measure that that group of people, over 65, they're allowed to go outside on Tuesdays, Fridays, and Sunday evenings between 6 p.m. and 1 a.m. for 30 minutes within 300 meters of their home. My mom said she's not doing it. She said it's not worth it because when she goes out, she likes to go for several kilometers. So as you can see, it's quite restrictive of what you're allowed to do. Yeah. Next, dog walking rules. This was a matter of a lot of memes on the internet. So the dog walking rules are that dogs may be walked every day between 11 p.m. and 1 after midnight. So very late in the evening. And also on weekends during curfew between 8 a.m. and 10 a.m. So in the morning for a period of 20 minutes within 200 meters of your home by a maximum of 2 people together. So that's even shorter, 20 minutes only to walk your dog. Yeah. Another thing is all public parks and public recreation areas have been closed for visitors. Public gatherings are limited to no more than 2 people. And people obviously need to observe 2-meter distancing from each other. And also, once you go into a kind of indoor facility that's open for public, you have to maintain the space of, I think, about 4 meters inside between people. So it's even more. When it comes to business, supermarkets, pharmacies, gas stations, and post offices, banks, so these important service providers, they are working, but they need to observe the curfew as well, which means that they have to, most of them are closing by 5 p.m. or earlier. Some shops will reopen and some of them have reopened already, but cafes, restaurants, shopping malls, pubs, and so on, they are all closed. Barbershops are closed and so on. Now, when it comes to travel, commercial flights to and from Serbia are suspended indefinitely, but cargo traffic is still allowed. All border crossings are closed, so the air, land, and to rivers, that's all closed. And the government of Serbia requires a mandatory 28-day self-isolation for anyone who entered the country on March 14th and later.
This is quite stringent. How do you explain such restrictive policies from a political point of view? Like, why is it stringent?
It is because of the approach of the current president, I think. He's very keen to get a tighter grip over power.
Okay.
And this is my view is that there are many other measures that these are just illustrations. Is really the push to strengthen and consolidate power. And this is part of an ongoing dynamic that has been going on. And one important aspect is media capture. Yeah. I'll give you an example of what the president does. He comes on, and we also have these press conferences and so on. One day he came and I was watching the report, and the president was saying, I was so severely wounded by the blows of the opposition, so wounded that I saw it on. But it was so dramatic and theatrical with so many pauses, and it was very, very dramatic. I couldn't believe that it was real. So I had to call my family and said, is this a joke? Is this kind of like, those fake funny videos that people make? But it was actually real. So basically, it is part of the power capture and power consolidation in Serbia that has been going on for a long time, but people are quite fed up by now. There are many other measures that I kind of wanted to highlight. One of them is that the financial fines for breaking the rules are quite high, and they can go up to 1,500 euros. And bearing in mind that the level of salaries in Serbia and monthly income of about, 350 euros is average. This is quite a lot,
But that's quite relevant, and maybe we'll come back to you once we have had introduction from everyone, because I think what you're highlighting is really the link between the way the crisis has been managed and power, right? And
very much so.
Political leadership and style. So moving to different countries, I wanted to turn to Agathe, if you don't mind. And the case of France, because I think when we talk about also leadership and power, and France has also taken not as stringent measures as Serbia, but quite, let's say, yeah, restrictive measures for big EU member states compared to Germany, for instance.
Yes, thank you, Sarah. So I'm Agathe Piquet, and I'm the postdoc research assistant for the NEXTEUK project, and I'm French, living in France, so a little bit different compared to my colleagues. Yeah, I think I was going to say that France had set quite restrictive measures, but then I heard what Dave said, and I was thinking, no, maybe not that restrictive. But I think that France is quite an interesting case when you think about the fact that it's one of the most affected countries, and at the same time it has one of the best health systems in EU. So I think this comparison is quite interesting, and one of the reasons that a lot of people have highlighted to explain this quite slow answer from France is the centralization of the management of the crisis management in France. So really the idea that when you have such a centralized structure, you don't have an effective answer. You mostly have a very slow, very inefficient crisis management. And so this was, for instance, reflected when masks were bought. So all the masks were bought by the central government and then had to be distributed to the whole country. And so this whole centralization was really pointed out by different commentators, especially compared to Germany. And one of the main answers given by these commentators to explain this difference between France and Germany was the fact that in Germany you had this local, you had these regional initiatives being able to react much more quickly with much more creative solutions compared to the central government. So I think that this is part of the answer, but you also have other explanation really to highlight when you compare France and Germany. You also have to take into account, from my point of view, the fact that you had maybe a much more prepared German government to the crisis compared to France, where we had a really slow reaction. We needed a lot of time to take this different measures. And I think you also have to think about the positive aspects of this crisis management in France being centralized, because, for instance, we were able to have a distribution of ill people. So, for instance, in the clusters in the east of France, you had these ill people being moved to other regions where you had much less people being infected, to be sure that you didn't have hospitals being overloaded by people. And you also have quite a quick setting of the lockdown. So the lockdown was really decided on Saturday in the evening and started in Saturday night. So I think that's also one of the things you can think about, how this lockdown was effective or not. But I think that the rapidity of this lockdown was also something linked to the central government.
Okay. Well, thank you. And just to remind our audience, France has about 160,000 cases and about 21,000 deaths. Just moving to Tim now. So we have seen different perspectives from the Greek success to different type of measures in Serbia and in France with this aspect of centralization. I think the UK was initially more going for herd immunity and then has moved also towards a lockdown. So can you give us a little bit your perspective on what happened, and also from a political point of view?
Well, there is some debate as to whether the government ever really did buy into the herd immunity idea. Certainly critics of the government would say that it did, but those defending it would say that it was never really more than a kind of offhand remark. But one thing that people can't understand is how slow we were to go into lockdown, compared to other European countries, particularly because we had the example of other European countries that we could have followed and therefore done it much earlier. What people also can't seem to understand is why we abandoned the track and trace, test and trace model that seems to have been so successfully employed in some other countries, and in particular South Korea and Germany are the ones that are often brought up in that respect. Clearly, if you look at the figures from the UK, we are running somewhat behind in time to Spain and Italy, but probably along the same sort of track as far as the numbers are concerned per percentage of the population. There's been quite a lot of debate as to how accurate the figures are in the UK and how comparable they are, not least because they don't officially anyway include those who have died in care homes, which are clearly full of the most vulnerable people and have probably lost a fair few people. There has been, over the last couple of days, an argument made that actually the figures released as hospital deaths aren't really particularly reliable indicators of the reality of the problem, and people have suggested that instead it might be best to look at so-called excess deaths. In other words, looking at the number of deaths that have occurred overall compared to those that occurred at the same time, for example, last year. And if you do that, you get a much, much higher figure. But we'll see. I mean, I think those arguments will be raging for quite some time. As far as the lockdown procedures are concerned, they certainly aren't as detailed as the ones that we've had detailed so far. They are really much, much more general, really, and they are for everyone to stay at home if they can work at home. Some people are allowed to go and work if they feel that they can do so in terms of social distancing. And obviously, if they are key workers, most schools have been closed, but not all schools. Certainly, schools who cater for very vulnerable children and children with special needs have been kept open, although many of the parents have not been sending their kids anyway, so they're operating with fewer staff and for fewer days per week. The big debates in this country really have been around the government's failings, in particular with regard to personal protective equipment, so-called PPE, in hospitals and indeed in care homes as well. And there certainly have been some major problems with distribution in that respect. The National Health Service, however, does seem to have coped reasonably well in terms of something that was previously considered to be a problem, and that is ventilator capacity. And certainly in terms of intensive care beds, that's the real win, I guess, for the National Health Service. They don't seem to have been overwhelmed so far. So to the extent that the government's strategy was all about flattening the curve and making sure the NHS could cope, it has been successful, albeit with some problems on PPE. There have, however, as a result of those problems, been some political difficulties for the government. They're having to defend the fact that frontline staff aren't getting the PPE they need. They're also having to defend themselves against their seeming inability to get as many people tested as they suggested that they would need to do and should do earlier on. Both of those problems have been brought up again and again by journalists, and are now being brought up again now that Parliament has reconvened virtually, but that's only been the case for this week. So we've had a very long absence of, if you like, democratic scrutiny on the government. That's also been made more complicated, obviously, by the fact that the Prime Minister, Boris Johnson, himself contracted COVID-19 and was therefore incapacitated for some time and still remains officially off work. That really hasn't helped the government's response, I think, although clearly we have collective cabinet government in this country rather than presidential government. So overall, I think what we've seen is a rally around the flag effect politically for the government. The government seems to be very well supported at the moment in party terms and more generally. And certainly there's been very widespread support for the lockdown, although we sometimes get media stories of people breaking the various regulations. They are really only a very, very small minority. By far the majority of people are cooperating with this. I myself have got a personal experience of this since someone in my family contracted COVID-19, and that meant that we have been effectively quarantined for 14 days. Today is the last day of that quarantine, so I'm looking forward to being able to actually go out and maybe go to a shop tomorrow. But it's also affected my family, as it has affected many other families, in the sense that if you have elderly relatives, as we were hearing earlier, there are considerably more recommendations and restrictions for them. If you have, as I do, parents in a care home, for example, those are completely quarantined and locked away. So I certainly haven't been able to go and visit my parents for a month and a bit now. And I know that is the same for friends in the same position. And that obviously can be quite difficult.
Well, thanks a lot for this overview of different perspectives, and I just wanted to complement with the Netherlands view. So I spoke about this smart lockdown in the sense that we have only a few rules, but surprisingly quite well respected, and which are the 1.5 meter distance, social distance amongst people, and mostly only university, school, daycare, museums are closed, but most of the shops are open, except for bars, restaurants, and cafes. And all these measures have been extended until the end of May. Schools are going to open again as of 11th of May, partially. We don't know yet how. And large-scale events and public gatherings are forbidden until 1st of June. So I would say it's a halfway compromise between different models. But I think overall, from what I hear from the different country perspective, is that we see different responses depending on political leadership, depending on infrastructures, healthcare, and also I think one point you made, Tim, that was quite interesting, is also how this crisis also what it means in terms of inequalities within countries across Europe as well. And you were giving the examples of schools, some schools still being open in the UK too, because being at home means also it raises also a lot of inequalities. And my second, maybe the second dimension of this debate is to think a bit forward. And of course, Europe now is starting to relax a little bit lockdowns across different countries. So we have also these discussions. I think the Commission proposed, it was a 2 trillion euros plan for supporting European economy with a recovery fund. How do you see the future of European integration more generally? And of course, for Tim being based in the UK, I'm really interested in the future of EU-UK relations. Also, following this maybe last tensions around an EU public procurement for medical equipment that would have been refused intentionally or not. Was it a political decision? Tim, what is your view on the future of EU-UK relations given the crisis?
If we take the more specific question first, this is the question as to whether the UK government could have participated in various procurement schemes, but for some reason did not do so, or at least did not do so until very, very recently. We had something of a political bombshell in the last couple of days when, after a senior civil servant at the Foreign and Commonwealth Office appeared in front of the Select Committee and suggested that the decision not to participate was a political decision, made by ministers after they had been briefed. And then that very same evening wrote a letter to the committee completely rowing back on everything that he'd said and denying that it was a political decision or that ministers had been briefed. It's very difficult to know the truth of that. I suspect, though, and this is merely a sort of educated guess on my part, that there was a decision made quite early on, probably at the end of January, beginning of February, by the government that they didn't want to become kind of entangled in any EU schemes, having left the European Union on the 31st of January, and therefore rejected participation in those schemes. I quite frankly can't believe that some emails went missing, which was the first excuse. So the question then is whether that really has made very much difference to the UK in practical terms. And at the moment, I would suggest that that doesn't seem to be the case. It's certainly, I don't think, going to be possible to provide some kind of smoking gun whereby anyone could prove that by not participating, the EU somehow caused more people to die or get ill. But you know, from a purely political point of view, it is, I guess, quite a scandal if it suggested that the government, you know, didn't tell the truth about why it didn't participate, and B, having admitted the truth, the civil servant was, as it were, some people would say, obliged to write a letter rowing back on what he said. Now, in terms of the generalities, I mean, I think the most pressing question is really whether Britain, having left the EU but being in this transition phase, will need to extend that transition period. It was already looking very, very tight for any free trade agreement to be done between the UK and the EU by the end of this year. The timetable is even tighter than it looks because the decision on whether transition should be extended has to be made by the end of June. And we are now seeing an increasing number of people, and even some people on the Eurosceptic Brexiteer side, beginning to say, you know, we can't really deal with both of these crises at the same time. There just simply isn't the bandwidth to do it. It really, you know, would be a crazy thing to go ahead with leaving the EU, particularly without a deal at the end of the year, when we're still trying to come out of this crisis, if indeed we are coming out of the crisis at that time. However, the government has made it very clear on several occasions, both through you know, political statements and statements from civil servants, that they are not planning on extending the transition. Now, you can either say that that indicates that they are going to take that hard line, or you can say that actually they will in the end decide to extend the transition. They just need to be seen to be doing it under force majeure rather than actually kind of welcoming that extension. So I think it hasn't really impacted COVID-19 necessarily on our kind of wider relationship with the EU, which was already, I suppose, quite fraught. But there is, I think, a very much more kind of immediate concern about how we handle transition and whether we extend.
Okay, thank you. So maybe I will go through the reverse order, and maybe I was wondering, in terms of broader perspective about European integration, whether Agathe, you're able maybe to let us know what are your thoughts on the future of the Franco-German relationship. You have already hinted towards it, but it would be interesting. I mean, both countries are taking different political positions when it comes to the recovery plan as well. What are your thoughts?
More broadly, I think really that the EU is today at a crossroads. So the EU has been through a lot of crises, and we heard that the EU is built on crisis. So this is quite a recurrent discursive approach. And I do think that we have to take into account on one side that the EU was quite slow to take some decisions, especially due to all these debates between North and South, and you mentioned it, with the Netherlands being quite hostile to the idea of the Corona bonds, and Italy calling for help. So this is quite, this was quite close to what already happened during the Eurozone crisis. But on the other side, I think we also have, we also need to highlight the fact that we had some crucial decisions being taken in really a short period of time, in less than 1 month. I think that this crisis also highlighted the need that we need some cooperative and some collective work on to get a vaccine, to get some medication. So I also think that this is something which is clearly shown, and this crisis has also emphasized some solidarity, for instance, between France and Germany, with a lot of French people being moved to Germany to be cured there, also French people being moved to the Netherlands. And so we had these different moves within Europe. I think that's something quite interesting, but right now I think that the future of the European integration is quite uncertain. And this morning we had the Minister of Interior, Christophe Castaner, who stated that the opening of borders will not occur in a medium term. So we don't know what's going to happen close. Lockdown in France is quite still uncertain, and this also happens for European integration. But in regard of the relation between France and Germany, I think that both Emmanuel Macron and Angela Merkel are really involved and really want this European integration. And we had this speech of Angela Merkel saying that the crisis was going to be one of the biggest tests for the European Union. We also had Emmanuel Macron stating that we needed Europe. And so I think that this motor between France and Germany will really help the European integration to go further. And I'm not sure it's going to pose after coronavirus if the leaders want to take this path.
Okay, that's very interesting. Thanks. And do you think, just to build on what you say, that a social Europe would be maybe one of the future points of debate, or it's too soon to tell?
I think one thing which was really revealed by the crisis is the lack of knowledge about Europe. We had a lot of people saying that Europe needs to do something in the medical field to act to find a solution, but Europe does not have a very important competence in this policy field. So I'm not sure we're going to go further regarding social Europe. Even now, the UK has gone, and it was one of the most reluctant states to have this social Europe. But I think that when you have a look on the different solutions used by the different member states, we have a really lack of harmonization, and we have states not really willing to take solutions developed by the state. So I'm not sure we're going to have a further social Europe.
And maybe on this, I see, Stella, you're nodding. So you've worked a lot on the Eurozone crisis, and maybe you see similarities or differences with what's happening at the moment. And maybe, it won't be about social Europe, but better coordination in the future, maybe? Do you think that lessons have been drawn?
Sure, yes. I think we've seen similar patterns, this slow beginning. But in reality, I agree with Agathe that it's not really slow. It's pretty quick in reality. The ECB very quickly announced measures that took much longer to be announced in the Eurozone crisis, and they go further than they did. And we already have a first agreement at Eurogroup level, finance ministers, for this pandemic crisis support fund. There has also already been clear that conditionality is not a good idea. The Netherlands was very keen for conditionality, but at the end, and this is a lesson I think that we learned from the Eurozone crisis, but also it also shows that it's a different crisis. We cannot have this moral argument against the South as we had in the Eurozone crisis. So we cannot really, it's very difficult for politicians to sustain an argument that somebody did something wrong in this case. This is a pandemic. So, and we still don't know if it's going to be only the South affected. So this idea that there is not going to be a conditionality in the first instance is very important. Of course, there may be, I mean, politicians are still discussing whether it's going to be loans or it's going to be transfers, what we're going to see. We don't know the exact amount that will be needed. So if the amount grows very much, it is likely that we will need also a little bit of conditionality at some point in order to get loans and to make them look also good for the markets. So it's not only a political issue, but it's also how markets will react to it. So I think there has been quite a lot done already. Interestingly, although we don't have a health policy, European health policy, this is not the competence of the EU, as Agathe said. We did come to an agreement very quickly for these PPE competitions that the UK did not participate. And there is a lot of sharing also already of best practice about how we're going to get out of this, what kind of steps are going to be. So although there is no harmonization, I think we've seen quite a lot, plus quite a bit of solidarity, even if it is gestures. So apart from the movement of patients towards Greece, we've seen solidarity in the sense of trying to do something for the immigrants for the first time, yeah? So rather than just accusing Greece that is not taking care of the immigrants in the camps, which is a very scary situation now, you know, with the COVID-19 pandemic, these refugee camps are really seen as a hotspot. Fortunately, we haven't had any huge incidents up to now. They have managed to contain it, but there have been gestures like moving children to Austria, to Germany, that they have been waiting to be moved for ages, sending materials to Greece to be able to, you know, cope with the crisis. So it's gestures, it's not huge, but I think it plays well in the media. And it creates a good platform for further discussions, cooperation. But it depends how deep the crisis will be. If the money needed is going to be too much, then we will be facing a very different situation.
Okay, and maybe moving to Davor, I think if we think about the future of the enlargement, this might also have some implications for Serbia. And I saw also that I think Serbia and Montenegro could also apply to some solidarity fund in relation to COVID-19. That are you afraid that maybe the enlargement negotiations would be impacted?
I don't think so.
No,
because now it is quite favorable for the EU to pursue enlargement because the UK left. So that's just my general view. To prove that the EU is still a viable organization, I think the EU is actually quite keen on continuing enlargement. When it comes to, you mentioned something important, and I want to make a broader argument about the assistance, financial assistance. Well, the European Union has already provided assistance to Serbia to the level of 7.5 million. That's not that much. And there are other further measures to contribute to the level of several dozen million euros still to Serbia. But my view is that obviously coronavirus crisis has caused what it has caused within the EU. But I think one really important aspect that we haven't mentioned yet is that that will develop now in external relations, and that concerns the role of China. And the role of China is linked both to the EU and to Italy and to Serbia, because when the crisis happened, the first country to respond was China. Yes, they caused the crisis and all that, but they've also kind of acted very quickly to try to portray themselves as being the good Samaritans. So China was really one of the first actors that have gone to Serbia and supplied and gloves and masks and other types of personal protective equipment, and also doctors and other specialists and experts to Serbia. Stay there, and effectively the Serbian government has adopted the Chinese approach. Basically, you have Chinese doctors in Serbia who are dictating Serbian health policy now. And I think that is really important to note, also for the EU. So because Serbia is not yet EU, and that concerns Italy. When Italy triggered Article 222 on the solidarity clause, it asked for help by other member states, but nobody responded. Guess who responded? China. China was the one that responded and sent over the stuff that was needed. Only then did the EU start reacting. So in that sense, the EU's response was slower. So that's one aspect. I think another aspect that's really crucial here is competence. So right now, public health is a policy where the EU can only act to support, supplement, or coordinate national action. I think what COVID has done is that it will trigger discussions on whether this should be changed. Because right now, according to EU law, the most important type of measure that the EU can adopt is incentive measures. And I think that there will be discussions on whether we should move to some kind of harmonization. I'm not sure whether that will happen, but I think discussions will be held. And the reason why I think they will be held is the conference on the future of Europe, which was announced to last 2 years on all aspects of European integration, especially on the future and the future trajectory of integration. And very recently, the Vice President of the European Commission for Democracy and Demography, Dubravka Šuica, from Croatia, actually said that conference will focus on public health, on whether the EU should move towards some kind of stronger role in the public health policy. And the last thing I think that the coronavirus crisis has caused is talks about the mutualization of debt. I think that's a critical thing that will define what the nature of European integration in the future will be like. Obviously, we have 3 member states that are staunchly opposed to the mutualization of debt. They're Germany, Austria, and the Netherlands. However, we see signs on the part of Angela Merkel that they're hinting towards openness to this idea. And that opening is in the use of the EU budget as a fallback to any issues of debt instruments, specifically bonds. So we will see what will happen here. And as we speak, actually, the European Council teleconference is going on. They start in 3, just like us. So we will know a little bit more about what they discussed later. But I think these 3 aspects are really critical: competence, China, and financial assistance / economic recovery.
Yeah. Is a very valid point. And maybe just to sum up what we have discussed, you have done it already very well, Davor, but I think maybe, I don't know if there will be post-COVID-19 times ever, but I think indeed for Europe, we can, even though some might find the response too slow compared to China or chaotic at the beginning, I think our speakers, Agathe and Stella, have really highlighted also how, in fact, quickly it has delivered some answers and some responses compared to prior crises, that there are elements of solidarity happening. And as you were mentioning about the mutualization of debt, are we moving towards also the end of austerity politics more generally? And we see very interventionist policies, and even the UK that is exiting, we see that the budget that has been proposed by Rishi Sunak is actually quite more in line with, a proper welfare state type of interventionist budget. So even though the UK is also outside, I think this economic crisis that is looming will call for change towards the end of austerity. And you mentioned the role of China, definitely key, possibly also times of the end of, US empire. Maybe is China, going to play a new, different geopolitical role. We know that with the Belt Road Initiative, I think it was in Greece that China also has invested a lot at the end or during the crisis. And I think it also brought, for instance, the Piraeus port as well. So these are very important elements. I don't know if anyone has a final reaction or remark on the future of EU. No, that has not been mentioned. Final point, I think most of you also mentioned migration or mobility, the fact that it will have an impact, I think, on Schengen, how it works on borders. And on migration, definitely we see that, you know, migrants are probably the most vulnerable ones when it comes to the economic crisis. There will be an impact on remittances. There are also big European states realized that they need migrants to harvest, you know, strawberries and asperges, and now there are being Eastern Europeans being taking flights to the Netherlands actually to do that job. So these will bring a lot of new issues and hopefully, indeed, as you were, I think, hinting towards more solidarity as well in Europe. Thank you very much for taking part in this discussion today. And yes, goodbye.